Hello, everyone. It's Monday, October the 5th. Regretfully, again, we have 6 additional deaths since Friday. The way it's been going, you know, it's better. But 6 additional deaths is way too many. But it is surely trending in a way that looks like it's getting better. Our 356th death was an 86-year-old female from Fayette County. Our 357th death, an 82-year-old female from Kanawha County. Our 358th death, an 81-year-old female from Kanawha County. Our 359th death, a 53-year-old female from Kanawha County. Our 360th death, an 86-year-old female from Kanawha County. And our 361st death, a 70-year-old female from Putnam County. That puts us at 361 total deaths in the state of West Virginia. We've now tested over 596,000 tests. Our cumulative average is down from 2.77 or 2.78, I think 2.77 down to 2.74. In the last 24 hours, we only had 114 new cases. That's a whole lot better. Our daily percent positive is at 1.52, and that is dramatically lower. Our active cases are at 4,330. You know, our recovered cases are at 12,051. We still have, this number is pretty much the way it's been, 165 people that are hospitalized. Here's a number that is amazing how fast it moves and how alarming it has been, and we have adjusted, and we have made some improvements in some places for sure. But this is an amazing improvement, Our effective reproduction number is at 0.86. We're wanting so much to keep that under 1.0, but at 0.86, it's very good. It is the second best in the country. So we have come from dead last to the second best in the country. So things are getting better. We have no counties in the red. We have Harrison, Upshur, and Boone County in the orange. We continue to offer free testing. The Guard, our DHHR, the local health departments are all across our state offering that testing. It should be up on our website and everything, and we encourage everyone to take advantage of this free testing. It won't cost you a dime. It absolutely is painless for the most part, and absolutely it is the very key that gives us the information that we will have that will be able to curtail and stop this dreaded killer. You know, on the counties that are in orange, Harrison, Upshur, and Boone counties, all these counties that are in orange today, and this week we'll be offering additional free testing in all 3 counties, and I really encourage all residents to get out, children, as well as residents, you know, any other adults rather, to get out and get tested. Now, in addition to that, counties that are in the gold, take advantage of the free testing. Don't drop your guard. And the first county I think of is Kanawha County. We have got to continue to test in Kanawha County and test more and more and more. Now, we tested 2,000 people in Kanawha County last week, and it sounds like a lot, and compared to what we were doing, it is a lot. But we have 178,000 or whatever people in Kanawha County. 2,000 is not very many of them. You heard Clayton Birch said at some point in time it would be great if we got every single person in the state of West Virginia tested. So we've got a long way to go, and I encourage all those counties, and especially I'm encouraging Kanawha County, go get tested. Please get tested. Our Saturday map showed 2 counties in orange, that was Harrison and Boone, and 5 counties in gold, Doddridge, Barber, Randolph, Jackson, and Kanawha County. I especially congratulate Kanawha County for working really hard to get yourself in the goal and getting yourself back in school. That's great stuff, and I'll promise you with everything in me, we will continue to make our schools as safe as we possibly can, and do any and everything we can to assure that we have adequate, if not over-the-top PPE and any and everything. And I thank our teachers and all those that are making all this happen and are making it happen for our kids, because we all know, every last one of us know, so many kids, if we don't put a face on them and everything, so many kids are apt to fall through the cracks. I can't tell you the need for our special needs kids and on and on. So I'm really happy we're back in school, and that's good. We have currently 16 outbreaks in our schools, with 42 confirmed cases in public schools reported to the Department of Ed, and this information is available there. You'll see, as we continue down this path, we will continue to have an outbreak here and there, and we run to the fire, and we absolutely take care of it, and we do whatever we have to do and everything in order to ensure the safety of all involved, and that's what we're going to continue to do. I mentioned to you on Friday that we've been working with our medical experts on outdoor live music. For the time being, we are still limiting live performances to outdoors only, with capacity limits and face coverings required. Our medical experts believe this is still in the safest and best interest of everybody. And we have drafted guidelines that will be available on my website later today. As for our long-term care facilities, we have 41 outbreaks in our long-term care facilities. Churches, we now have 12 outbreaks. That's not good. Reported in churches in 8 counties. Upshur is a new county. We still have outbreaks in Logan, McDowell, Tucker, Harrison, Nicholas, Fayette, and Kanawha counties. Again, I go through the same thing over and over. A pew in between you. Wear your mask, social distance, wash your hands. If you're elderly and everything, maybe it would be a good idea to skip church for a few weeks. Watch online. You know, absolutely, there's so many different things that you can do to protect yourselves and everything, and help us to be able to protect those that we love so much, and that's the elderly. We have got to really watch out for them. At corrections, we're down to 4 active inmate cases, 2 at Mount Olive, 1 at South Central Regional Jail, and 1 at North Central Regional Jail. In both jails cases were positive before they had been arrested. So we have 13 active cases with our staff, and the National Guard continues sanitization work at Mount Olive. Flu vaccine, I encourage you to get your flu shots. You know, you saw me get mine the other day, completely painless, nothing to it. You know, just please get your flu shots. We're now up to right at 133 million. It's gone out to our cities and our counties, and we continue to ask them to continue to apply. You know, from the census standpoint, we're tied for first in the country at 99.9. You've done a whale job there, West Virginia. This week is Physicians Assistance Week, and I have proclaimed this week as Physicians Assistance Week in West Virginia. It's also the National Physicians Assistants Week. And we all know what the contribution to our PAs is. It's unbelievable. You know, they're our first line of defense, and they do phenomenal work. And I know so many. There's no point in me going through each and every person that I know, because they're just all over the place. They do fabulous work. Congratulations, and it's just an honor, you know, for me to be able to honor you for all the goodness that you do. Last thing I would tell you is just this: if you'll look at our charts, you know, on our recovered cases and our total active cases, we're kind of trending. Just, you know, we've almost been status quo there. I'd like for that to widen out more. On the middle chart, from our daily percent positive, you know, you'll see that we have dipped way down below that dotted line. You know, yesterday, you know, that's the lowest day we've had for a long time. And you'll see from the standpoint of the third chart, our cumulative percent positive, we're starting to tilt down just a little bit. That's good news too. I want us all to not forget our president. You know, it seems like the news that's coming out is good, and I think the news on our First Lady is good, and so I surely appreciate you letting me pray with you and pray for our president, and as our Bible teaches us in every way to pray for our leaders, and so I am very, very hopeful for a speedy and complete recovery for our First Lady and our President. So nevertheless, that's all I've got. I think we're doing better, but we are very cautious about that and very concerned, because we know how fluid this situation is and how it could whip around and get us. But you'll see that we're in school in all the counties. There's 3 counties that we're not in school today, but we've been back to school now in all counties. That's really good. Our color map, whether you know, want to cast rocks or whatever, is truly working. It's worked amazingly well, and sure, there's always things that you're going to have to change and pivot and move and everything else, but it's doing great. I really appreciate all the good work that our teachers are doing, and you know, I wish to goodness, you know, and I'm sure I'll get questions about this later, but you know, we don't need special interest groups, you know, casting stones. I mean, for crying out loud, anybody in their right mind can see that all this is working, and it's working well. But anyway, thank you so much.
All right, thank you, Governor. Let's first today go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. It's great to be back with everybody. I want to reinforce what the governor has said around our reproductive number. So as we look at our RT value, we have been stuck at the worst in the country for a good part of a week. And with our enhanced testing and continued intervention or mitigation measures that we are very much grateful for all of our citizens to follow, which is wearing masks and physically distancing and washing your hands. Again, those things really help with influenza as well. And as Dr. Amjad has said, get your flu vaccines and avoid the 3 C's, the crowds, the closed indoor spaces, and the constant contact, 15 minutes or greater with people you don't live with. What we have also seen, both from some recent studies that have come out and also from what we are seeing from the White House, is how quickly COVID can spread in any organization. And we know that the president and the first lady and the folks there have gone to extraordinary measures to try to make sure that that area is very safe. And as we've said, COVID is ubiquitous. It's everywhere. And so despite all of the measures taken, we have evidence that there's been a spreading event at the White House and perhaps even at the Rose Garden celebration, which is outside. And certainly we pray for the president and the first lady and all the people there who report positive infections and all the people everywhere. I mean, COVID has killed over 1 million people in our world and 200,000 people in our country, infected over 7.44 million in our country as well. But it really does tell us how important it is for us, even if we're outside around other people, to continue to wear a mask and try to stay physically distanced and do those things, because COVID can spread between people. And from a recent study that I talked about a little bit on Friday, and this will be my last comment, from India, 2 villages in India, the thought is from that epidemiology that 5% or so of people there infected 80% of others, and 70% of people infected in those villages infected nobody else. So a real small number of people, 5% in that study, or 8.9% in the Annals of Internal Medicine study, infect 80% of everybody else. So that is why it's so important, as that other measure of running to the fire for each of our citizens, is to get tested. And not only if you get symptoms, and certainly if you do get symptoms, we want you to get tested, but in the areas that we see the orange color, the red color, the gold color, or people working in areas where people are really vulnerable and susceptible, it is really important that we continue to test. And we've tested about 1/3 of our state's population in quantity, but we really want to get those numbers up 7,000 to 8,000 tests per day. So West Virginia, you're doing really well. Really proud of you. Number of deaths and the rate of people dying is also coming down, which is really, really encouraging. But as soon as we let our guard down, that's when COVID will come back and humble us. So keep up the good work and make sure you're continuing to do those mitigation measures, no matter what color your county is.
Thank you, Dr. Marsh. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. This week's focus for the National Guard will continue to be on assisting DHHR and our local health departments with a significant amount of testing efforts across the states, and as the governor pointed out, in specific counties. In addition to that, we will continue to work a significant number of disinfection missions. I want to just report that our PPE surge supply is in good standing, and we do have enough in the surge supply right now to address up to a 6-month surge. For those providers out there and organizations that need PPE and are having issues with that, please reach out and we will provide you with the appropriate sources as to where to go to get that PPE, particularly if it's up to your organization to procure that, but we can provide that assistance. In addition to that, working with Dr. Amjad and the strike team to support Secretary Davis and his team at the Clarksburg State Veterans Home to be able to assist with a positive among a staff person there. Also, last thing I want to do is this past Saturday, we welcome home the balance of the 150th Cavalry Squadron. We're excited to have them home, glad to have them back with their families. We have 3 remaining members of the organization who will be in this week, and that will close out that organization's deployment. Thank you.
All right, thank you, General. Next, we'll go to Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer.
Good afternoon, everyone. I don't have any prepared remarks, but I would like to thank our local providers out there again. We have some health departments that are working extremely long hours, some staff that are fatigued, as are the staff at DHHR. I just want to thank everyone for what they're doing. We are doing well right now, as Dr. Marsh said and as the governor said. But if we let up at all, we're going to see increase in cases. We're seeing more outbreaks daily in a wider variety of locations, a wider variety of settings. So please, everyone, wear your mask. Please social distance, and please try to keep yourself and your family safe and your neighbors safe. So thank you. Any comments?
I do want to mention there is a website called vaccinefinder.org. There has been some questions about where to get your flu vaccine if you cannot get it with your family doctor, or if you're not attending one of our testing events. Vaccinefinder.org is one where you can see where to get your flu vaccine, but pharmacies, our testing sites are offering them, but that is one website you can go and look at that. Thank you.
All right, thank you both. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams of Ogden Newspapers. And since you opened the door for it, Governor, I presume the special interest group you're referring to is the West Virginia Education Association. They announced just a little bit ago that they have filed their injunction in regards to the school reentry map and metrics. I know in Kanawha County Circuit Court, they'll be hearing a case tomorrow morning regarding a high school quarterback from George W. High School, George Washington High School. Obviously, your comments are probably going to be somewhat limited since these are now active lawsuits, but can you comment any further on the claims made by WVEA that the current system really just kind of covers up counties with problems? They specifically, I think on Twitter, pointed to Upshur County as an example of the metrics being a little misleading, where at one point that county was bright red as of yesterday. Now it's in the orange or yellow today. And they also point to a couple other examples. Can you talk about that? Thank you.
Stephen, I don't know how much I can talk about it and everything, or how much I should, but I would just say just this is, you know, isn't it awfully coincidental that it's done 3 or 4 weeks before an election? I mean, it's political, and it surely smells of political. You know, from the standpoint of, I think, you know, from what I've read, from the standpoint of just purely going by the Harvard model, if we were going just by the Harvard model, we know we would have a third to a half of the state of West Virginia, probably the safest state in the nation. A third to a half of the state would be shut down, you know, from the standpoint of being in school. You know, there's another point that ought to be made here too, is if we just didn't have a colored code system at all, well, we'd be back in school everywhere. And we've got 3 counties that they praised me over when I deviated and changed, that if you had been to school and then your county turned orange, you could continue to go to school. But I said, no, I'm not going to do that. And so we changed it, and we made it to where you could not go to school in the orange at all, period, even if you had already been to school. And all 3 of these counties would have already been in school and would have been able to have gone to school today. But when I did that, they praised me. So you know, I think it's just more politics. The thing that I wish more than anything it would really be entertaining is to, if and I know we can't do this, but boy, would I have loved for them to have sat in this chair and made the decisions and then let me just sit on the sidelines and cast stones. It'd be awfully easy to do. So, but we know 70% of the people in the state of West Virginia wanted to go back to school, and I commend our teachers. You know, I don't know where our leadership is going, but really and truly, we are trying with all in us to make it beyond belief safe. And we know that there's a level of risk in me being here. There's a level of risk with our president. There's a level of risk everywhere. Now, we can make the decision to shut the whole state down. Everybody stay at home. And with that, there's risk too. And so So we know all these things, and our health experts, our education experts, everybody from all the way down to giving our parents a choice to whether they want to send their kids to school or not, all the way down to giving the local boards of education are making their decisions, and they're putting out their guidances and all that kind of stuff. We know every bit of all this, and we've tried to take every ounce of it into consideration, and we have. And so from the standpoint of, if they sue, if they don't sue, that's up to them. I could give a hoot. Really and truly, at the end of the day, I'm going to continue on trying to do the right things. I'm not going to try to do the next political hit job or whatever it may be. And I'm going to continue to do the right stuff. And so if they sue, they sue. We'll let the lawyers, fight that out.
All right, thank you, Steve. Next to Kenny Bass with WCHS and Fox 11.
So a lot to talk about today. I'll try to whittle it down to a couple of prongs to ask. One would be about the additional money that the state has come up through the surpluses, through the budget estimates through the first quarter. I asked several briefings ago about using some of that money for frontline healthcare providers as hero pay. I know that subject's been visited, and some counties have actually done it, like Cabell, excuse me. And some areas, private businesses like hospitals, have not seen anything. Have you explored that anymore to try to help these nurses and doctors who have been battling this thing since it started? And secondly, about the map, Buchanan Upshur High School is a part of this maelstrom with Upshur County. Their golf team ranked pretty highly, not able to participate in the state championship, at least at last I heard, which starts this week. Is it time to make another exception for you to step in and look at this? As you've said many times, golf is the most socially distant sport that you can participate in, and to let these young people participate in their state championship, work with the SSAC, and make it happen this week. Those are the two things I'm interested in. Thank you, Governor.
Okay, Kenny, from the standpoint of the second part of the question, is it time for me to step in, and allow these kids to be able to play? I mean, considering that they're outside, considering that they've been tested, considering that we're working with the SSAC, and with all that being said, in my opinion, now with the county being in orange, they can play, but at the same time, to jerk these kids back and forth, I don't think that's the thing to do. And I'll surely have a discussion later on today in regard with the SSAC. We've already visited in my office and everything, but from the standpoint of where I'm at, 4 kids on a golf team and everything, and all of a sudden they've been tested negative, they're going on to the high school golf tournament, and for us to keep them in limbo, that's not the right thing to do. It's just not the right thing to do. We ought to let those kids play. Now, from the standpoint of the monies, dedicating monies for heroes pay, I'm all in, Kenny. I'm absolutely all in. But to take excess dollars that are in the budget, I think that would have to take action from our legislature to be able to do that. From the standpoint of us having the dollars, we still do have the dollars in the CARES monies, and we're looking at all aspects of that and everything. I would be a real advocate to help these great people in any way and every way we can, because they truly are heroes and they're our first line defense.
All right, thank you, Kenny. Next to David Beard with the Dominion Post.
Hi there. Mon County's been green for about a week now, so I'd like to ask about the status of the bars possibly reopening. I figure that the possibility of a handful of irresponsible students or 1 or 2 irresponsible owners might play a role in some nail chewing. And I'd also like to ask, as part of this question, if WVU business owners and maybe even student leaders are involved in any conversations you're having. Thanks.
David, we're having a bunch of conversations with them, and I'm very, very hopeful that we'll be able to get the bars back open. And Mon County is doing a great job. The bar owners have got to really, really enforce, and they have got to enforce guidelines and everything, within the people there. And we don't need to just, a whole bunch of people piled in on top of one another. And I'm very, very hopeful that we're going to be able to get the bars back open. And the other flip side of it is just this, there's always, two sides to the razor blade. If you just think about just this, is if Mon County continues to trend the way we're trending, the bar owners and the people will really follow the guidelines and do stuff properly. And we just keep the bars closed there where people are going to travel. People are going to travel to other bars and everything in other counties, or maybe even across state lines. And as they do that, they're exposed. They're exposed to their driving and everything it may be. So we try to take everything into consideration. I'm very hopeful we'll be able to get them back open real soon.
All right, thank you, David. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. Excuse me for asking a non-COVID question, but I do have a question for General Hoyer, because we've received some indication from the Boone County Economic Development Authority that the National Guard is going to pull out of Hobart. Could you explain that and what the reasoning is behind it, if it's true?
Sure. We received information that the local Economic Development Authority no longer wanted the National Guard to participate in the efforts at Hobart. We have a national exercise that we have been slated to take on for next year, bring in a couple thousand individuals from across the country. It's a significant opportunity for the Guard, as well as a significant economic development opportunity. And we needed to make a decision quickly to address that, and we'll move forward, and we'll continue to do what we can to help the folks of Boone County going forward. But it appears that with the Economic Development Authority, the work at Boone County and Hobart just doesn't make sense anymore.
All right, thank you, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was just wondering if somebody could give us an update about our average weekly testing numbers. I know prior to the aggressive testing initiative, we were averaging about 3,500. The goal I know is to get up somewhere around 8,000. I was wondering how we're doing now that we've been doing the aggressive testing for a couple of weeks.
General, I think you're going to have to help us here more than anybody, but I can say, Charles, I don't know that we were really averaging 3,500. We were probably averaging in the high 2,000s, or maybe 3,100. But nevertheless, General, if you could tell us.
So, Governor, I'll start, and then maybe Secretary Crouch can highlight. But as you mentioned, Governor, we were down almost to the low 3,100 range at one point. Today's morning briefing that the Secretary and Dr. Marsh and I received, I believe, was over 5,800 daily. And Bill, maybe you could add more detail to that.
Yes, General. Happy to do that. As of yesterday, our average was 5,985. So we're actually increasing further. We now have 6 labs under contract with WVU. We are talking to about 8 more for a total of, we hope, about 12 to 14 labs, commercial labs. So we're expanding capacity. We're looking at the response time of those labs from the time they get the test to make sure they're within our time frame with regard to their reports. We're looking at 24 to 48 hours. If we have labs that are not responding appropriately in terms of the turnaround time, then we're moving to labs who can meet that turnaround time. So we're very focused on more testing. As the governor says, we are going to test. That's how we identify folks in the state that are positive, and that's how we beat this disease. If we don't test, we're not going to identify those folks. So we're looking at ramping this up to 7,000 to 8,000 in the next few weeks, and even further. Our capacity right now for the state is a little over 12,000 tests per day. So we are good to go with that. Part of this is logistics in terms of helping those local health providers find individuals either through EMS, through our FQHCs, federally qualified health centers, or through the Guard. And as General said earlier, he's bringing more people on so that we can push more resources out to the local folks to test as much as we can.
And Governor, I would add one other thing is that the first of next week, we will also, thanks to some work from DHHR, be bringing on pharmacies who will be doing the free testing in many of our communities as well, to get to the number that you've directed us to 7 and then on to 10,000.
Come back to me just one second. Charles, I think, if we're rounding, what we've managed to do is move from right at 3,000. And if you caught Bill Crouch's, I'm sorry, Secretary Crouch, if you caught that and everything, we were at 59.85 as an average today. So we've moved from 3,000 right to 6,000. So we've doubled, but we still need to go higher. And Charles, everyone listen and listen really closely. The great part about the 2,000 tests we did last week in Kanawha County is we found 80 some odd people that were walking the streets that didn't know they had this. That's the whole secret to the testing. We are finding people that don't know they have it, and then we're absolutely asking them to quarantine or quarantining them and contact tracing and doing all the work that we can do because we know stuff. That's the beauty of the testing. That's why I said that could be our best moment. That could be the very best moment that we have had. The best decision we made was to go out and aggressively test. And there's all kinds of positives that happen with it. We get our kids back in school, we get them back on the ball fields, we get lots of different things happen, but the number one thing that happens is this: we're able to find the cause, the spreaders, and then stop it. And I don't know the exact numbers in Kanawha County today, but as of the other day, I think it was Saturday, when I was on the phone with Dr. Marsh, Kanawha's infection numbers had started to come down just a little bit. Their positivity rating or percentage was put them in the goal, but their infection numbers started to move. Now that could have changed by today. I don't have an update on those numbers today.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I want to drag you to my neck of the woods up here around Hardy County and the Moorfield area. Hardy County has been green for the last couple of weeks. However, Moorfield High School has had to cancel its football games the last 2 weeks. I went to the state education department. They say that Moorfield has 4 cases. So it would indicate to me that Moorfield High School probably has those cases centered around the football team. I don't know if you could comment on that or not, but maybe generally, how many kids are affected outside of just the ones who test positive in the state? It looks like we have a handful of cases in maybe up to 15 to 20 different schools. That handful of cases, there would probably be contact tracing to where nearby kids would have to be taken out of school for quarantining. Could someone address that?
Dr. Amjad, you're going to have to address this because I don't know those answers. But anyway, Dr. Amjad.
Sure. Paul, I'm sorry, what exactly is your question? Because we can't really talk about, particular students or anything, but can you clarify your question for me, please, Paul?
My question would be maybe in general numbers to kind of put it in something that you can answer. How many kids outside of the ones that test positive have been forced to do remote learning because of positive tests in their schools? Have any teachers been affected?
Well, speaking of your county in particular, it's hard to give a number. The Department of Education would have more numbers to tell you how many have had to go into remote learning. But, the Department of Education right now is listing the outbreaks, and they could give you a number of how many had to go into remote learning mode for that. But I wouldn't be able to tell you an exact number, but they do keep track of their students to know how many classes or schools have to go into remote learning mode, as you mentioned, but I wouldn't have the exact number for you to give that right now, but they would have those numbers because they do keep track of the students and their classes and those numbers exactly, Paul.
All right, thank you, Paul. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Regarding the outbreak at the White House, what lessons can we take from that, considering that there appeared to be little or no wearing of face masks, no social distancing, and limited isolation to people who had potential exposures?
Well, Phil, I would say this, and I would say this if he was sitting here as his buddy, but our president probably should take more precautions. His people around him should take more precautions. It is quite apparent that even though they were testing every day, that some way, somehow, once this happens, and the impact is unbelievable from the standpoint that, if it's just as simple as this, if we can get this and this can infiltrate our White House and it can spread through people in our White House, then we've either got to be doing something that we can do better at, or we've really got to know that we've got to be on guard all the time. So, no matter where it may be, we've got to protect our president. We've probably got to do a better job protecting him. He's got to do a better job in allowing us to protect him. All of us know that, I think his words were really good in him saying, a leader cannot go upstairs in the White House and hunker down, and just stay there and stay safe, but stay there. A leader is expected to lead. And so he has to be out in front of us, and he has to be leading, and I do too. And with that, there's additional risk. But his people that are around him, and he, and maybe me too, we can all do better, at being able to watch and everything, because we need to protect him. I surely need to try to every way to help our people to protect me as your governor, but at the same time, I think in his situation that he could do better, a little bit better too, but I know his people around him are really making an effort now to tighten that up.
All right, thank you, Phil. Governor, back to you.
Okay, one thing I want us all to do is in our own little way, welcome all those members of the National Guard that came back. They all came back safely and on this deployment and everything. And we still got people that are deployed all over the world, men and women from our National Guard. And I want you to keep all those people and their families in your thoughts, your prayers always. I was going to talk just to you just 1 second about our president, but I talked just a second ago about one of the questions about our president, from the standpoint of how our color code map is working. I salute all the medical and educational and the Guard and all the experts that have been DHHR and everybody, local health and everybody that's been putting in the licks, but I also salute our teachers, all of our service personnel. They know there's a level of risk, but they're wanting to be with the kids, and our parents know the choices and all those different things that we have, and from the standpoint of the local control, and just there's lots and lots of stuff that goes into making these decisions, and with all that, we can't get rid of the risk. There's no point in me sitting here telling you that you shouldn't be concerned. I want you to be concerned. I absolutely want you to continue to wear your mask all over the place if you can. I absolutely want you to continue to wash your hands, keep the social distancing, take care of the elderly, do all the things, West Virginia, that help us get us to where we are safe. But the number one thing, in addition to wearing your mask, is go get tested. Go get tested. Because of all the people we test, we will find spreaders. We will find people that maybe for 3 or 4 or 5 days or a week or whatever it may be, you've got to isolate yourself and everything. Surely to God above, if I were to have tested, to be test positive, if you would be tested positive, surely to God above, we don't want to spread it to somebody else. But if we don't know it, we can't absolutely act on it, can we? And the only way we can know it is to go get tested. So please, 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 try to get tested as much as you possibly can. Not from the standpoint we need to just repeat tests, not that at all. Just go get tested. One time, go get tested. And that'll help us more and more and more as we go forward. And we're going to beat this thing. Our numbers are moving right in the right direction now. No guarantee they're going to keep on doing that. We may awaken tomorrow morning to an absolute, outbreaks all over the place, and then we have to adjust. It is a very, very fluid situation. I've said it and said it and said it. So with all that being said, I think West Virginia, you're doing good. You're still the envy of the nation. I thank all those that are making everything happen at our schools and everything with our kids, because they need you. They really, really need you badly. Anyway, thank you so much.